Hello and welcome. Our next 5Q podcast session is going to be something very much related to my earlier podcast about bariatric surgery. However, on this occasion, we're going to talk about revisional bariatric surgery. Let's go through the five questions again. First of all, what is revisional bariatric surgery? Revisional bariatric surgery is a form of bariatric surgery which is done on someone who's had a previous bariatric surgery. As we are all aware, bariatric surgery is usually done for weight loss and also help with other conditions such as diabetes or high blood pressure or high cholesterol, etc. Sometimes, after the first operation, there might be recurrence of weight regain or inadequate weight loss, or even sometimes people have complications such as reflux disease, ulcers developing in the joint, and these are potential indications for revisional bariatric surgery. So, revisional bariatric surgery is a type of bariatric surgery is done on patients who've had previous bariatric surgery, and it is indicated again either due to recurrence or regaining weight or inadequate weight loss or complications such as ulcers, malnutrition, reflux, etc. Going on to the next question, who are the candidates for revisional bariatric surgery? It's important that this question be answered in a context of a multidisciplinary team because it is not just an indication and it's not easy surgery. It's very important that we make sure that all other non surgical methods are exhausted before advising a patient for revisional surgery. So, the indications for revisional surgery, as I had mentioned earlier, are in patients who have put on weight after an initial period of weight loss or have not lost enough weight or due to complications. The commonest indications for revisional bariatric surgery in terms of complications is reflux after usually a sleeve gastrectomy. As we all know, sleeve gastrectomy is a refluxogenic operation, and up to about 40% develop reflux after a sleeve. So that's the commonest indication. Other indications include ulcer at the joint after a bypass. Rarely people lose too much weight going into malnutrition, needing further surgery either to change the type of surgery or rarely even to reverse the bariatric surgery. So this are the common indications for revisional bariatric surgery. Going on to the third question, what are the types of revisional bariatric surgery? The commonest bariatric surgery which comes in for revision is usually a sleeve gastrectomy, either due to inadequate weight loss, weight regain, or reflux disease. Patients who have reflux disease are usually converted into a bypass, whereas patients with inadequate weight loss or weight regain are offered another procedure called a mini bypass or a SADI-S procedure. A Roux-en-Y gastric bypass is not the best operation for weight regain after a sleeve, but it is the operation for reflux after a sleeve. Rarely, a revisional surgery might take the form of removal of a gastric band or conversion to another type of surgery. The other revisional operations are converting a mini bypass to a Roux-en-Y gastric bypass or a SADI-S procedure. Once again, the indication is not to be taken lightly and it's to be made, the decision is to be made after serious consultation with experts and multidisciplinary team input. That goes on to the fourth question, is it a safe operation? Or how good is the operation? Sorry, the fourth question is how good is the operation? The operation is good provided the patients are rightly chosen, rightly worked up, rightly operated upon, and rightly followed upon, similar to primary bariatric surgery. The most important outcome is the selection and making sure that we have prepared the patient and there are not other causes which can be mended before surgery. Patients who've had issues with faulty dietary discipline or other mental health issues or psychological issues which has contributed to the inadequate weight loss or weight regain, then it is important they are worked up and made sure they're optimized prior to surgery, or sometimes surgery might not be the right thing for them. Hence, selection is the most important thing when deciding prior to bariatric surgery for revision. On the same note, it is important we have an expert surgeon and a team to take care of this relatively challenging procedure. Leading on to the fifth question, is this safe and what are the risks and side effects? Revisional bariatric surgery is by no means a cakewalk. It is going to be a relatively challenging procedure and has to be done in appropriate situations with institutions and experts in the field with the multidisciplinary team involved in their care. There are relative higher risks of surgery, such as bleeding, infection, leak, but still they fall within the very safe profile of surgery overall, and they are very good if the right operation is offered to them. Complications such as reflux disease and malnutrition, which are the original indications for revisional surgery, have to be taken into account, and these may be life saving as well. So, once again, I'd like to reiterate, revisional bariatric surgery is an important armamentarium in patients who've had previous bariatric surgery with inadequate success with weight loss, weight regain, or complications such as reflux, ulcers, or malnutrition, and other small problems. It is to be done and taken with care, done by a team of experts in an appropriate setup. So, it is important that it is not taken lightly, but it is a very good method to help with these patients who truly deserve revisional bariatric surgery. Thank you once again for your time and listening to me, and please be free to consult me or pass your questions. Thank you.